when I make this mix of these three, I don't want to do it straight across. Mesial and distal always have different opalescence. You know, so typically on the mesial, I'll put TM05. It's like a grayish, mixed maybe with a little translucent neutral. So usually on the mesial, and on the mesial,
because this is very strong.
that's why I mix it with something. Straight is no good. A lot. So with initial, these are pretty good straight. The only thing is they are compared to some other ceramics. You have to really understand this. And with Lissy, they need some more porcelains. They need a deep denting or an opacious denting. They need it because in my lecture I was talking about PFM still. What you see is what you get. With Emax, everything is dependent on the substructure. What I see here, I don't know if that's what it's going to be. And even if it looks good with the denting here, this dentin is a little translucent from initial. So sometimes that grayish effect is not so much necessarily from the ingot, but it's about using too large of a mass of regular dentin. So we need an opacious dentin to control the opacity. Like, it's totally necessary. And I think a lot of people get caught up too much in mamelons and translucency. For me, the most important aspect of creating a match is opacity level. It's opacity level. And on the mesial, remember, if you look at a lot of natural teeth, the mesial has an area of translucency, but it's usually not long. It doesn't go up the whole tooth. On the distal, if you look closely, the opalescence usually goes all the way to the cervical. It goes all the way up. If you look at it with a different light, so if you take a picture from the side and the flash explodes like that, you will see an opalescent band from the cervical all the way down to the mesial. And you have to get into other things too, like never put pure opalescence on the edge. Always surround it with some kind of opacity. Like for a contrast, I'll say. So I'm going to draw this for you, and just to like not mix up porcelains because it's irrelevant, they're not even here and we don't have an oven, I will draw for you my first bake that I typically do. So, mesial, distal. If we're doing a bleach shade, again, A1, or believe it or not, D2. It's perfect, even on a bleach shade. Yeah, I mean, just for me. I always want some kind of chroma or contrast, and like I said, when a doctor prescribes you a shade, like so a bleach shade, BLD2, this is the area that you have to focus on matching. If this is a little more chroma, or if this is a little brighter, or this is a little brighter, and this is a little off, it's fine. This is what you're focused on. And I think that the monochromatic crowns you see, like I said earlier, comes from just taking this and putting it on the whole thing. And even though the patient thinks they're going to like it, I don't think they will. So on these line angles, I would put EOP2. So I have a bright shade and a bright line angle. And different brightnesses, different values of bright for contrast. On the mesial corner, I'd use TM05 mixed with translucent neutral. And again, on the distal, a lot larger. Mesial small, distal a lot larger, and EOP3. And then in between here, I'm creating I'm creating a translucent wall here. It's basically a canvas, so if I'm going to layer it across, and if I hold it to the light, you'll see directly through it. Like you'll see directly through it. But then I take my mamelon powders and I put them on top of it, always checking with the light where the mamelons are. I'll show you in a second. So this would be TM01, CLW, and TO. So that's my first initial bake, and what I'm looking for here is value or shade, different contrasting areas, and then mamelons. So I know that there's like the one bake technique where everyone loads it all on, but I can't do that. Maybe I'm not talented enough or what, but I like to do two bakes. I like to do this as my color and effect bake, make sure I have the color, make sure I have the effects, and then after, I'm just putting on a window to explode my color. This and that. I think a lot of technicians make a big mistake where they underlayer and then they compensate with these enamels. And if you do that, you're just making a white or gray tooth. Because that's all these are. So I'm gonna start layering here. Is I cut this up. So when it comes to mixing, there's two schools of thought. There's zero mixing at all, just putting it onto a wet tray, you know? And then there's mixing like this. I'm gonna mix like this because I don't use wet trays, I use glass still. And I always use needles. Like I just fill up the liquid from here with a needle. Number one, this is a great tool. So I always have a needle with a thicker liquid. And on posteriors, I pick up my stains dry. And I'll put the stains in here, and if it's too dry, I can always just push this. I put a drop out, but there's still some wet residue on the end of the needle, and then you can pull with the wet. So this is like a great tool for staining posteriors. But I cut it up, and I just inject it in like this, because you have more control. I see a lot of technicians when I teach courses, they mix everything up, and then they put the liquid on, and it's like oil and water, and it just becomes a mess. So cut it up like, so I'm typically using a drop of this liquid that they have here too. It's called Seraphim. So I just put one drop in. But why I said I have two liquids is that some ceramic I want very wet. Like when I use my mamelon powders, I like them like water because I don't want to layer them on. I want them to be sucked in, like so when I put a very wet ceramic onto something that's not so wet, it like absorbs. And typically when you're layering with not so much room here, I see a big mistake that what people will do is, let me see how this mixes this thing. They'll take something like that and they'll literally make this like finger line. It's way too thick. What I want to do is literally make this like water and just like let it suck in. I'll show you when I layer real quick.
So what was that one with just the one drop that you put in?
It's called Seraphim. So when I start layering, and even like, this is like a weird awkward show I'm in right now. If you want, you could even like pick this up and feel it. I think you should. Like, so this, I mix with less Seraphim, and you can see the consistency of this. So I guess I'll just start layering. So this would be A1. So when I'm layering chroma, I'm always going into the interproximals. Always. Even sometimes down further. Now this is just going to create a contrast. And also, when you put it on like a line like that, always feather it, please. See what I mean? Always feather it, because I never like when it's just like boom, like what I was saying earlier, talk, 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 talk. It's like too organized. So then, take a look at this now. With the Seraphim, it's like, you want to feel it? You want to feel it?
Really stiff.
Yeah,
Hard to move around.
It's like wax. Yeah, but again, moisture control. So if I put this in,
Now, does that keep it wetter longer? Or anything?
it does. So I will only say this. It's so crazy making like teeth, you know? Like everything is important. Like everything. So if you're using Seraphim, you're like dry time. I don't change, so I only, okay. I have 3 programs on my furnace, that's it. Everything is matte. Every program I fire is matte. It's weird, so I don't use dry time.
Every program is what? What did you say?
It's manual.
Manual. I see.
I have like a metal ceramic program, an alumina program, believe it or not, and a zirconia program. But I change everything on the fly. Number one, I do that because I never ever again want to press. I don't want to be a monkey and just press buttons, and it forces me to think like, what bake is this? What do I want? Do I want to overfire this? Like things like that. So I always do that. Sorry, I just want to make sure this is wet. And I don't have a dry time, but I just stick it on the muffle and I just go do something. And my dry time is my eye. I come back and look. It's dry. Boom, go. You know, like that's how I do it. But I'll show you. So I have my chroma all around. I start to form with dentin, but I like this because you see the consistency is like wax. You can make like sharp, weird points. So always, guys, what I'm doing is that mix that I'm putting across the front, no problem. I'm always again mixing that with my glue, my base shade. So you guys are all technicians, right? You guys all know what I'm talking about. Like, so a transition dentin is very important. So I'm going to start the creation of the mamelons with the transition dentin.